Welcome to Active Living at the Active Life. Today we're in the LGTV studios for a very important session. You don't want to miss this. We're going to be talking to District 4 Health Services about the COVID-19 vaccine. Essential information. And we are blessed today to have with us Hayla Folden. She's the Media Relations Specialist with District 4. And thank you for being here, Hayla.
Happy to do it. Thank you for having me.
Well, we're going to ask a lot of questions because our participants, our older adults in Troup County have a lot of questions about the COVID-19 vaccine. And you're the one we're turning to for some answers today. So thank you for joining us here in the studios. Hayla, the big question is, why should older adults get the COVID-19 vaccine?
Older adults are more likely to have severe complications from COVID-19. Some people, like myself included, can get COVID-19 and have some mild complications. You know, we might be sick for a week or two, sometimes 3, but we're able to recover quickly. But our older adults, those 65 and older, are more likely to end up in the hospital, to be on a ventilator, and in some cases, those are the ones that we're seeing that are passing away, and we want to prevent that.
Wow, that is the tragedy in the time that COVID has been in our community. The Active Life members and former members, the 14, we have kept up for 14 older adults in our community that were involved with the Active Life in LaGrange passed away because of COVID. And so it's very real to us. And so a question that I'd ask for you is, if an older adult is concerned about, is the vaccine going to cause me a problem? Am I allergic to any of the ingredients? Where should they turn for the answers to that?
I would recommend that anyone that has concerns turn to their doctor. So ask your personal physician, because most people can get the vaccine with no problems. But if you have some illnesses that you're already dealing with, we may need to know that your personal physician has granted you permission before our providers will feel comfortable giving you that vaccine. So we will ask you to have that conversation with your personal physician ahead of time.
That is great advice, because unfortunately people listen to rumors in the community. They get on the internet and Google things and see the most absurd suggestions of why they shouldn't take the vaccine. But as you were saying, this is a life and death matter for older adults.
It is, and unfortunately that has also created a demand issue that we simply can't meet. We don't have enough vaccine for everyone that wants it right now, and it's made it difficult for people to get through to schedule an appointment, and it's made it difficult for us to help everyone that is requesting vaccine. But we are trying everything we can to come up with a system and a process that works and is fair. But until we receive more vaccine in the community, both for public health and for the local providers that are enrolled to give vaccine, we're not going to be able to vaccinate everyone that wants it.
Right. So people need to hold on until we're able to get the vaccines that we need out there. And you say multiple outlets like drugstores, grocery stores, some of those with pharmacies, yes, doctors' offices, along with District 4, then that will take some of the burden off that you're experiencing with trying to get through phone lines and to get an appointment.
Yes, I think so. I do believe in, say, 3 to 4 more weeks, we'll have enough supply and enough locations offering it at the same time that it will be so much easier to know who has vaccine and who doesn't and where you can go to get it. And that will work great as long as we don't open that phase up further before everyone that wants it can receive it. Okay. So if we do that and continue to open the phases before we meet the demand of the current phase we're in, we'll continue to see this issue of not having enough vaccine.
Okay. All right. So you had mentioned earlier about that there may be some reason somebody is not eligible at this time, and I was looking at the brochure. If a person has just got over COVID, there's a period of time. Is it 90 days they should wait before eligible, or is there, what are your guidelines for people that have actually got over COVID, tested negative, before they'd be eligible to take this vaccine?
If you currently have COVID, we ask that you give yourself time to get completely over it.
Okay.
But once you're over it and you are no longer symptomatic, if you want to receive the vaccine, you can. What we know is that research shows you have a natural immunity for roughly 90 days.
Okay.
So if you want to extend your immunity, then you wait. If you can wait 90 days and then get your vaccine, and so you know you have that natural immunity for 90 days, and then the immunity from the vaccine on top of that.
So it may be strategic for you to go ahead and wait up to 90 days to get that vaccine because of the natural immunity.
Right. And if you're at the very end of your 90 days, you may want to go ahead and start trying to find an appointment for your vaccine.
Okay.
And now, if you are in quarantine or have been exposed to someone who has COVID, we want you to go ahead and wait out your quarantine period before you try to get the vaccine, because it is not prudent for you to get an appointment and try to get in line to get this vaccine, and only to have COVID the day of or the day before. If you are running a fever or look sick at the time you show up for your appointment, the providers will not vaccinate you. We ask that you be healthy and not sick at the time of your appointment.
That makes sense. And it won't help a person that has COVID, right?
No, it will not help.
So there's no, they should wait till they get through that.
That's correct. We also ask that if you've had a vaccine in the last 14 days, that you wait. We cannot give you a COVID vaccine if you have been vaccinated with any other vaccine in the last 14 days.
Okay.
So if you have had a pneumonia shot or are planning to get a pneumonia vaccine or a flu vaccine, don't get it on the same day as your COVID vaccine or in the coming week before your COVID vaccine. Either give yourself plenty of time to get that ahead of time or wait until after you've received your COVID vaccine.
Excellent. That's very valuable information. Now, let's talk a little bit about the procedure if they sign up. Right now, you are doing vaccinations on North Davis Road at the Troup County School System bus area. And as a part of that procedure, everybody will fill out a vaccine information and consent form.
That's correct.
Okay. Tell us a little bit about this, where this is available, and so that people will know what's going to be asked, and if anything on this brochure would rule them out for getting the vaccine.
That vaccine consent form is available on our website at district4health.org. There's a red box that says, it's got the 1-800 number to call to make the appointment, and just under that is a link for the consent form. Printing that out ahead of time and filling it out gives you some time to read it and look through it and make sure that you have clearly taken the time to read the material and write clear so that we can read it at the site. We use that information to put it into the Georgia Registry for Immunization, which is where all of your vaccine information is placed in Georgia. There's a registry for immunizations. But if you forget your form, or if you have questions about it, those forms are available at the location. So someone can help you fill those out once you get at the site. And people will be reviewing that material with you once you get there. I personally have not looked at that recently. If you want to pass it over here, I'll tell you if there's anything on here that says that you cannot. There's one block. Have you received convalescent plasma? So if you had COVID-19 in the last 90 days and you were hospitalized and received plasma, then you would not be eligible to receive the vaccine. I believe that is the only one on the list that will knock you out. If you are allergic to some things, the allergy question on here will let the nurses and the paramedics on site know how long to ask you to wait, because they will recommend that you wait 15 minutes, a minimum of 15 minutes after you receive your vaccine. But in some cases, they may ask you to wait 30 minutes, depending on your allergy history. And then they will monitor that parking area where you're waiting to see if you're having any kind of reaction.
That is wonderful. I'm glad that they do that. Now let's talk about the procedure. So at the North Davis location, I understand the entrance is the north entrance, and they come through there. They're in their vehicles. Just kind of walk through for our viewers to know what to expect. When they're driving up in the car, do they get out of the car, stay in the car? What happens so that can give them a preview of what to expect when they get an appointment?
Okay, when you drive up in your car, someone is going to meet you at your vehicle, ask you if you have an appointment. They will ask you what time your appointment is. If you do not have an appointment or cannot tell them what time your appointment is, and they can't find you on the appointment schedule, you will be turned away. So be prepared for that. Without an appointment, you will not receive a vaccine that day. You will be asked to leave the location.
That's important. So people need to understand clearly, not first come, first serve.
No.
It's appointment only.
Appointment only. You will be turned away without an appointment. Once they have verified that you have an appointment, they will ask you if you have your form. If you have your form and have already filled it out, it's just going to save a little bit of time. You will be given extra forms because there are a couple of documents that we're required to provide, and then you will just move ahead in line. Someone will review your forms, and then once they've reviewed your forms with you to make sure they can read everything, you continue moving ahead in line. So this process should take you maybe 20 minutes max. That's with the 15-minute waiting time.
Wow.
It should only take you about 5 minutes to get from the start of the line all the way to getting your vaccine and waiting, and then 15 minutes to wait.
And you stay in the car the whole time?
Stay in the car the whole time.
Okay.
You'll be asked to roll up your sleeve or pull your sleeve down so that you can show this upper muscle area on your shoulder.
Okay, so they would need some kind of clothing that would be easy to see a bare spot of skin.
A bare spot, yes.
In the upper part of their arm.
Yes,
Okay.
I've been telling people to either wear a short sleeve that you can pull up or to wear something loose so that you can pull it down. Either way, you're going to have to get this part of your shoulder visible and clearly visible. A nurse is going to give you a vaccine, and then they're going to hand you a card. I should have brought one of those with me. You're going to receive a card that tells you which vaccine you have received. On the back of that card is a date. That date is the date of your next dose that you need to receive the dose by. So it is not an appointment card. We're not telling you you have an appointment on this day and to show up at this location. This is going to be a date that will probably, because Troup County is receiving Moderna, so you will most likely receive a date 28 days out. That will be the time that will be 28 days from the date.
Is there
of
a
your first
range? Does it need to be right on 28 days? Is there what's the flexibility?
I don't know the exact flexibility, but I know you don't have to receive it right at 28 days. Okay. But you can't receive it before. You need to receive it after the 28-day mark. And we will be working to schedule those second dose shots later. We ask you to give us a call about 2 weeks after your first shot so that we can then begin scheduling those second doses. But you don't have to get it from us.
Any place they would offer.
Get it anywhere. Just make sure you get the same vaccine.
Okay. And so that is vital. People need to understand one shot is not enough.
That's correct.
If it's two, because it won't get the protection without the two shots.
That's correct.
Okay.
We want you to get the 2 shots, but we want you to understand you are not getting that appointment for the second shot at the time that you're getting your first one, and that you can get your second shot anywhere.
Okay, all right. Now, this vaccine that they're receiving, and before they're able to get it, and even afterwards, they still need to be diligent, wearing their mask and social distancing, right?
Yes, please.
You don't know as far as if they could still spread the disease, and there's a lot of questions, but we want them to make it to the vaccine, but it doesn't necessarily mean they walk around like they're bulletproof.
That's correct. One of the things I want more than anything is for people over 65 to get back to living. I know many people that have just shut themselves in their homes and they're not doing their normal things. So they've completely lost their active lifestyle. We want to see them back there but not the same week they receive their vaccine. So please wear your mask, stay at least 6 feet apart, and avoid crowds. Keep doing what you're doing for now until a minimum of 2 weeks after your second vaccine.
Okay.
A minimum.
And so they can feel a little bit more confidence, go into the grocery store, having interaction, but still being careful.
Yes, please be very careful.
That is vital. I don't know if we made this clear, but there is no cost to receive the vaccine. Is that correct?
There is no cost from us. So for any public health site in the state of Georgia, the vaccine is free of charge. We are not charging an administration fee to give it. You, depending on where you get it, you may come across locations that require an administration fee of $21 and some change.
Okay.
That is legal. They can do that. They can't charge for the vaccine, but they can charge for the people that are giving the vaccine. So that is possible.
Okay. Now, one thing that we were talking about before of just the massive number of people that want to get vaccinated now, but the bottleneck of them getting an appointment all on this one telephone number has been very frustrating for a lot of our older adults. And you were saying that hopefully if there is more medication that's spread out at drugstores and physicians' office and all, that we might get some relief.
That would help us tremendously to get some relief, both for our staff and our seniors. They would have more options. On the Department of Public Health website, there is a vaccine locator where you can put in, I don't know if you put in your county or your city or your zip code, but there is an option to put in some information there and search for vaccine. But I can tell you that we are doing everything we can with the infrastructure we have available. And I know that 1-800 number is not ideal. It was an urgent last minute need that we had to come up with, and we're doing the best we can with it. We have 10 people answering the phones all day long, and we simply can't meet the demand of phone calls coming in. I can appreciate the frustration. We're feeling it on our end as well. We have been keeping our website updated. There is again, the red box tells you if we have vaccine and are taking calls. So sometimes we are completely out of vaccine and we no longer accept phone calls because we have no vaccine to make appointments for. And when we do have vaccine, we have a vaccine clinic box that you can click on to find a vaccine clinic, and it will tell you where we have appointments available and where the appointments are no longer available, so that you can at least scroll that box. So if the 1-800 number box says that we're taking appointments, you can scroll the other vaccine clinic location and find kind of where it's available at. And we still, unfortunately, the only way to make an appointment with us is through that 1-800 number. Our staff we're getting phone calls on our cell phones and emails, and people are showing up at the office, and we simply will not take an appointment except through that 1-800 number right now.
Okay, well, we're hoping that as more people get vaccinated and more vaccine is out there, that will be a little bit easier for our older adults to get through with that. But we appreciate all that you're doing. We know it's been a tiring job over the last 10, 11 months, and we are hoping that we can get people vaccinated as soon as possible and get some relief. I know we all want to have a mass burning party at some point.
We do. Oh, wouldn't that be fun, a mass burning party? Yes, there is nothing we would love more than to vaccinate everyone that wants it.
Yes.
That would be great.
So we thank you so much, Hayla, for joining us today. And again, to summarize again, we've got a free vaccine that they don't have to fear. They need to talk to their doctor if they're concerned. Don't listen to other people, and we'll get them protected so that we can make it through this. And we appreciate all that y'all are doing, and thank you for taking time to join us today.
Thank you.
Well, thank you for joining us. I hope this has been informative. We at the Active Life on our Facebook page We'll take the information from District 4 and post it there as we receive more information and information in the community about other sites that may come available. Holmes Pharmacy has been one of the sites that's been vaccinating. So we'll try to pass along that information to you as soon as we can. And be patient, hang in there, and be safe. And thank you for joining us today.